All right, well, welcome everyone to your 2022-2023 annual enrollment presentation. This is just going to be a brief overview of the upcoming changes this plan year and really high-level highlights of just some of the benefits that you have offered at Unity School. So I really appreciate you joining today. And I'm going to go through this pretty fast because we have about 30 minutes to get through 45 or so slides. So if I'm talking too fast, please feel free to pause me. I am recording this session, so you will be able to watch it back later. Just a brief introduction. My name is Rachel Mangus. I'm the Senior Director of Operations. We have Janelle Rivera, who is the Director of Member Services, monitoring the chat box. So if you do have any questions, if I go over something too quickly, you feel free to ask a question in the chat box. I would caution you to please keep the questions that you're putting in the chat open to the good of the group, because we don't want personal information floating around for everyone to see. So with that, I will go ahead and get into the presentation. As Paul has mentioned before, with joining ICUBA and being a member of ICUBA, you guys take benefit of the strength in numbers as being one of our member institutions. So we're really excited to present open enrollment this year to 25 member schools as part of ICUBA, and we are grateful that Unity School is one of our members. We're going to quickly review the plan changes for the upcoming plan year effective April 1st, 2022. We have a couple of enhancements to roll out for you. First up, we have a new FSA administrator. We heard some grumblings over the prior year with our prior administrator, WEX, our current administrator rather. They were originally Discovery Benefits. They were bought out by WEX, and people are just not happy with the substantiation process that they have been putting people through. So effective April 1st, 2022, we will be moving to a company called Ameriflex. With Ameriflex, we will have a short blackout period with the current cards. So your WEX or Discovery card will not be active after March 14th for your flexible spending accounts. And you will get a brand new shiny debit card from Ameriflex by April 1st. Your ICUBA debit card is a convenient way to save or to access your funds. These are pre-tax funds that you contribute to a flexible spending account. So this is something that you would have elected last year. So this is something that you already have in place and is also available for you in the coming year. With the Ameriflex transition, there's 5 simple steps to help you navigate through the transition. I know that flexible spending account is limited on Unity's campus, but if you do have any questions about the blackout period or the transition to Ameriflex, certainly reach out to us and let us know. You can also reach us at benefitsadministration@icuba.org if you have any specific questions. Just a reminder, the ICUBA debit card, what the funds that are placed on that card are those flexible spending accounts. So the flexible spending account is contributed by you, the employee, for eligible healthcare expenses. It's using pre-tax dollars, and participation in medical insurance is not required. The thing to keep in mind about this account is these are use it or lose it funds. And with the use it or lose it benefits, it's really important that you plan wisely when putting money onto that card. The debit care spending account is a little bit different. This is also contributed by you as the employee, up to $5,000 per year. And this is for eligible daycare expenses for dependents under the age of 13. So if you are paying for childcare, day camp, stuff like that, this is for child care services, not healthcare. This is also use it or lose it. We do have some medical plan enhancements. The existing medical plan, the 4,000, 8,000 plan, is getting a new name. It's going to be the same plan with a little bit of a new copay structure, and the new name is going to be high deductible PPO. Our board just decided that 4,000, 8,000 deductible plan was too much of a mouthful, so they wanted to simplify things for you. The preferred PPO plan is also going to share a new, more affordable copay structure with the high deductible PPO plan. So we will be shifting that preferred PPO from a co-insurance structure as it is today into more of a copay structure. And that's hopefully just to be the benefit of our members. The copays that you will receive in both of these plans in the new plan year after April 1st are a $15 copay for primary care pediatric visits, $20 copay for therapy and chiropractic services, or a $35 copay for specialist office visits. So there will be no more co-insurance for office visits after the new plan year. Co-insurance will stick around for anything that's subject to the deductible. We're also enhancing our medical benefits with a new benefit from Embold. This will be integrated into the Blue Cross Blue Shield search tools, but this is a new program that we're bringing to expand on our $0 benefits for total care providers with primary care, pediatrics, and internists. The Embold Health Network will open up that free copay, those free visits to extend to obstetrics, orthopedics, cardiology, pulmonology, endocrinology, and also gastroenterology. If you visit one of the Embold Health providers, that means that you will have $0 moving forward. So what is Embold Health? You might be wondering. Embold Health is really just a network optimization tool. So your network has been optimized. IQVIA members get immediate access to better care with no out-of-pocket. What Embold Health does is they evaluate the physicians within the network, and they identify the top 40 providers within the Blue Cross Blue Shield network. So while all of the physicians in the network are, in network and available for you to go to, if you visit one of these top 40% of these specialists, you will receive care in their offices at that $0 copay. This new badging and ability to search for the Embold Health providers will be available in early February. So as of today, you cannot log into My Health Toolkit, but as of right now, how you search in My Health Toolkit for those total care providers, starting in early February, you will also be able to search to see if your specialists are also Embold providers. Oh, I got ahead of myself. So this is where you can log in through IQVIAbenefits.org through the single sign-on section. You'll click Find a Provider, and this is where you can search, not right now, but starting in early February. You'll be able to search your providers to make sure that they are Embold. So this, if you really like your doctor, you are fine sticking with your doctor. But if you would like to switch to the Embold physicians, then you know that your physician is in the top 40% of those clinicians and also at a $0 cost. So no cost, no deductible, no barriers to care. IQVIA does a lot of work behind the scenes to break down those barriers to care. So it's really important that you're just an educated consumer and you understand the benefits when you're going to the office. So when you're in the physician's office, you just need to be aware that total care and Embold Health providers are no cost. Anything that's preventive, bone mineral density scans, colonoscopies, adult and child immunizations, all of that stuff is all at no cost to you. We have a lot more variety of no cost benefits. This is just a small sampling. We also have several benefits that are not subject to the deductible, including MRIs, chiropractic service, convenient care, and several other visits that are not subject to the deductible. And most of these will be at that low copay amount moving forward. We do have a few of the higher price items that are subject to the deductible, but still we do not have barriers in place. For durable medical equipment, hearing aids, home health care, those items are a little bit more costly to the plan. So we will share with you the cost, and those are subject to the deductible. Those will also have a co-insurance associated with them in the coming year. The high deductible PPO plan, formerly the $4,000, $8,000 deductible plan, is still going to stick with that same higher deductible and a 30% coinsurance for anything that's subject to the deductible, but we'll have those lower copays sprinkled in, as you can see, for physician office visits, therapy, specialists, convenient care, teledoc, urgent care, and those will all be at those lower copay amounts. But the plan specifics, the out-of-pocket maximum and the deductible, are remaining the same. The preferred PPO plan is the same deductible and out-of-pocket as well. Still has that 20% coinsurance for anything that is potentially subject to the deductible, but then you will also enjoy those lower copays, or the flat amount rather, of knowing what you're going to pay at the physician's office each and every visit. Just to keep in mind, Care Connected is also still in your corner. This is the number located on the back of your Blue Cross Blue Shield ID card, or you can call IQVIA's toll-free line and press option 2 after the prompt, and you will be connected with Care Connected, and they can assist with any claims questions, billing questions, help you find one of those Embold Health providers. They do a lot of stuff behind the scenes as well. So if you have any questions related to your Blue Cross Blue Shield benefits, Care Connected is here to help. Just a quick overview of IQVIA's prescription drug plan. This drug plan is not changing in the coming year. Prescription drugs are included with your medical election, and this plan does also include free diabetic supplies and chronic condition medications. So if you're eligible, if you're on medications for stroke, heart disease, blood pressure, or osteoporosis, you may have realized or benefited from that $0 copay. This does have a separate out-of-pocket maximum, and that is really to protect you if you are a member that takes a lot of medications, but not so much you do not visit the doctor very frequently. That separate out-of-pocket maximum is meant to protect you. And just one thing to highlight on this page, that a 90-day supply will save you some money. So if you notice, a non-preferred generic is $10 for a 30-day supply and only $20 for a 90-day supply. So you're essentially getting 1 month free. IQVIA Cares is also here to advocate for you. This team of pharmacists serve as a liaison between you and your doctor, and also the pharmacy and the insurance company to take the burden off of you. So if you have questions about prior authorization, medication therapy management, any adherence questions, or if you are impacted by an upcoming formulary change, all these are great times to reach out to an IQVIA pharmacist advocate. Mental health really matters. I know that I've seen an uptick in the news lately about, the real push to take care of your mental health. And certainly that's at the top of everyone's mind during these tough times of the increased stress due to the pandemic. So just to keep in mind that the EAP is here to assist all employees. You do not need to be enrolled in the medical plan. You do not need to be even a benefits eligible employee. You just need to be an employee of Unity School. So if you call this number 877-398-5816 and press option 1, they will connect you with the EAP, and press option 2, they will connect you with the behavioral health. The behavioral health is the component that is paired with the medical plan. Being paired with the medical plan, this is also switching to a copay structure for both plans. For those office visits, they will match the $15 primary care office visit for any outpatient services related to behavioral health. The inpatient services are those more costly items, so the inpatient services will be a co-insurance and subject to the deductible. And if you have any questions, please feel free to reach out to Aetna. Able to is also a really cool benefit that we get from Aetna. It tackles life and health issues. A few of them are highlighted here on the screen. So if you're dealing with infertility, diabetes, depression, postpartum depression, grief or loss, this pairs you with a health coach and a behavioral coach twice a week for up to 8 weeks. And this program is proven to be very, very beneficial, really helps you almost learn new ways to deal with these stressors in your life. So we're going to go into some exclusive benefits for IQVIA, and these are IQVIA medical plan members. So all the programs that I'm about to review are covered also through your medical plan benefits. They're free add-ons, if you will. Teledoc, we've talked about Teledoc over the years. Teledoc is a really convenient way to get a doctor on the phone if you're experiencing a minor or more mild illness. So if you are coming down with a cold, you have allergies or bronchitis, those are great times to reach out to Teledoc. Teledoc, you can quickly have an appointment with your doctor, schedule it on your phone, and be on your merry way. Surgery Plus, just a reminder, Surgery Plus for non-emergent but medically necessary services will save you money. So these are licensed, board certified, fellowship trained, and they've been screened for malpractice sanctions and criminal records. These cover surgical procedures that are non-emergent but medically necessary. Something that you can plan out in the future, like say, hey, this summer, I think I'm going to take some time off of work and I'm going to get my knee replaced. That's something that you don't need tomorrow, but you can plan out in the future. That's what we mean by non-emergent but medically necessary. If you choose to go with a Surgery Plus surgeon, your deductible and co-insurance are waived, so the procedure is no cost to you. If travel is included, it also includes a travel benefit. Hinge Health is also getting a few enhancements in the coming year. Currently, they cover chronic high-risk conditions only. And what Hinge Health does, it's a physical therapist health coaching program that you can do in the comfort of your own home. So starting in February, Hinge Health will be expanding its program to also include prevention acute for recent injury, or pre or post-surgical therapies as well. So if you have an ailment with a musculoskeletal issue and you're interested in learning more about Hinge Health, you can register at hingehealth.com/IQUBA. Are you ready to rally? I know I am. We've increased this incentive pool this year from $330 to $380. The main increases are highlighted in the box. For completing your biometric screening with a physician results form, that incentive is increasing to $100, and for completing an annual wellness exam, you'll get $50. So essentially, for that one visit, if you have your doctor complete that physician results form for you, that one single visit that you're going to anyway can earn you $150. So how do you get that biometric screening accomplished? You must visit myquestforhealth.com to download the physician results form. If you've never used it before, your registration key is IQUBA and your unique ID is your Blue Cross Blue Shield ID card. The cool thing about the physician results form is the form is actually unique to you, and all covered employees and covered spouses are eligible for the rally incentives. So if your spouse is on the plan, make sure that they are also completing their biometrics. Just a quick update on any voluntary benefits. We have two PPO dental plans through Delta Dental, a base plan and a buyout plan. Not huge differences between the two plans, other than out of the plan year maximums, the base plan has a plan year maximum of $1,500, and the buyout plan has a plan year maximum of $2,000. The orthodontic benefits, the base plan covers child orthodontics only, up to $1,500 for a lifetime. And the buyout plan covers adult and child orthodontics up to $2,000 for a lifetime. And just one thing to make note of, the Delta Dental PPO network is a little unique in the fact that they have an in-network physician, a premier network, which is still an in-network physician, but just at a higher cost share for the employee, and then out of network. So we want to keep in mind that we never want to go out of network. So in-network is always the best. That will save you the most money. As the lowest deductible. And then the premier network, like I said, has that little bit higher cost sharing with you, the member. The DHMO is also available for an option. This is that comes with flexible DHMO benefits. This is the preset copay that you'll pay for all of the services rendered. So it comes with that schedule of benefits. It has no annual maximums, no deductibles, no claim forms. But you'll just have to look up, the service that you're going to receive and the copay that's associated with it. Keep in mind that a pre-selected dentist is required for DHMO for services under the DHMO. So if you do not currently have a dentist selected with the DHMO, you can select one of those during the annual enrollment period within the system. Also keep in mind that this is not available in all 50 states, and the states are listed within the system if you have children or other dependents that are outside the state. You guys offer the base plan from IMED. The base plan offers an eye exam every 12 months, covered with a $5 copay. You have a $130 frame allowance every 24 months, and that comes with a $100 contact lens allowance every 12 months. Income protection benefits are also offered through Unity School. You have basic life, voluntary life, child life, and spouse life, short-term and long-term disability. Those short-term and long-term disability benefits were added by Unity School, I believe, last year, and you have the ability to make those elections within the portal. If you do increase one of your voluntary life options, an EOI might be required. So if you do receive this pop-up letting you know that an evidence of insurability form is required, just be mindful of that. When you do submit your final enrollment, another screen will pop open, and that is the time to complete that evidence of insurability. You have to complete it at that time. So if you don't have all the answers to the questions, just do your best, and somebody can always reach out to you for a follow-up. We added this new lifetime benefit with long-term care in the middle of the year last year, so you might not have heard a lot about it. So I have added, this header is actually a hyperlink to a video if you'd like to learn more about the lifetime benefit with long-term care. This is actually a life insurance product that also covers long-term care if you should ever need it. So if you should ever need long-term care, the death benefit will also convert. And I have a visual on the next slide also to show how it will work. But you access up to 4% of your death benefit to use towards those long-term care services. The cool thing about this benefit is that you are grandfathered in, if you will, at the age that you purchase it. So if you are, in your 30s and you purchase this product, you are grandfathered in at that current price forever and ever. The premiums are not due after age 100. So if you're fortunate enough to live until age 100, you're all set with no premiums, and that this policy can continue until age 121. We have some QR codes here on the screen, and this presentation will also be shared with you so you can learn more about that benefit. These are the 3 scenarios that Paul asked me to include just to give you a little bit more information about how the lifetime benefit works. So in scenario 1, it's just a basic life insurance benefit. So no long-term care was required. You just have a $100,000 life insurance benefit. In scenario 2, it's split between death benefits and the long-term care benefits, totaling, the $100,000 face value. But if you do run into a situation where you need extensive long-term care benefits and the full long-term care benefit is used, it does have a restoration benefit of $50,000. So in the event of your death and your benefit had been completely used without those long-term care services, it does restore to have a $50,000 life insurance benefit for your beneficiaries. So the total death and long-term care benefits in that instance total $150,000. We do have some enrollers that are ready to help you understand all the voluntary benefits that we're offering. There's a QR code here to set up an appointment with one of those enrollers through Explain My Benefits, and they are happy to help at any during the enrollment process and answer any of the additional questions that you might have as it relates to any of the IQVIA benefits, really, but especially these voluntary products. Including AFLAC. AFLAC, let's not forget about AFLAC. There's 3 AFLAC offerings: critical illness, hospital indemnity, and accident. So critical illness and accident also come with a $50 wellness benefit that's included. So if you don't encounter a critical illness or have an accident this year, make sure that you're cashing in on that $50 wellness incentive. The hospital indemnity plan pays a lump sum cash benefit for any hospital admission or confinement due to an accident or an illness. That is including maternity, and there are high and low options with more information within the enrollment portal. If you currently have AFLAC, just a reminder to go ahead and make sure that you are filing your claims. Oftentimes we elect these benefits, during open enrollment, and then we forget that we have them. So if you had, the hospital indemnity or the accident plan, you elected it in the prior year, just a reminder, you're never too late to go in and file a claim. Group Legal Shield is a new offering that we have this year. Group Legal Shield protection is important to safeguard our physical health as well as our financial health and legal rights. With Legal Shield, you can protect your legal rights at an affordable rate. So this will be a flat rate of $17.50 per month. And I've also attached a video in this hyperlink if you'd like to learn more about this benefit. There's also a QR code here that you can scan that will lead you to a brochure with more information about the legal benefit. But this is assistance with personal legal matters like family-related issues, like adoption, speeding tickets, neighbor disputes, wills, preparation, and other documents, stuff like that. Last but not least, we have added nationwide pet insurance. Nationwide pet insurance, this is not a payroll deducted benefit, but this is just a benefit offering that you get as a Unity School as a member of IQVIA. Through our purchasing power, we do provide this link to you, and this is from the nationwide account to offer discounts ranging from 50 to 90% reimbursement on vet bills. So it's just another feel-good option, really, so you can protect those furry family members as well. And that is, that's all I have as far as benefits are concerned. So I will pause for a second if there are any questions, anything that I went over a little bit too fast, and then I will take you through how you can enroll in these benefits during the annual enrollment period. I don't see any questions coming through in the chat. I will keep going. So enrolling in your benefits, as always, you will visit IQVIA benefits portal. Just a reminder, we have that My Carrier Account single sign-on section right in the middle of the benefits portal homepage. So this single sign-on My Carrier Account section gives you direct access to our benefit brand partners. With these direct connections, you don't really have, it takes the work out of remembering all your username and passwords. So you just have to, for some of them, you set up an initial username or password the first time, and then from then on, you just log into IQVIA's portal and you can single sign on into these carriers. When you're making changes to your benefits this upcoming plan year, beginning on February 1st, you can is the annual enrollment time. So you're encouraged to, at the very minimum, to review and update your benefit elections. If you don't make changes, we still ask that you review them. It's also a great time to update your beneficiaries and just make sure that you have everything that you need for the new plan year. The benefits that are required are the flexible spending accounts. Those are required just as a government guideline. All the elections must remain in effect until the end of the plan year as stipulated under Section 125. This is a government regulation, so we are not the bad guys when we say, sorry, you're stuck, unless you have a life event. So if you do have a life event, you do have 30 days after, for instance, a birth, adoption, marriage, loss or gain of other coverage. You do have 30 days to make changes to your benefits after that point. We do encourage everybody view, print, view or email yourself a copy of your confirmation statement at the end. We rely on technology a lot. I know that I do, but stuff always happens and it's always nice to have that confirmation of what you did in the system. If you do have any questions as you're stepping through about which plan is right for me, Emma is also available to help. A quick reminder, when you're stepping through the process, you are also verifying and confirming that the dependents that you're enrolling in the medical plan or in any of the plans are in fact your eligible dependents. So by eligible dependents, we mean a legal spouse, child or stepchild, legally adopted or foster child, a child that's required to be covered by a qualified medical child support order, or a child that resides with you and you are their legal guardian. Dependents can be covered up until the end of the year in which they are age 26. So if you have a dependent that's turning 26, today, for instance, they are still eligible for benefits through the end of the plan or in the end of the calendar year. And we'll send you a quick reminder in November or December that it's time for them to move out of the nest and go out on their own. And that is pretty much, that sums it up from my standpoint. Are there any questions? All of the lines are muted, so if you'd also like to unmute your line and ask questions, you're welcome to. And the chat box is also open for questions for the good of the group, of course. All right, Paul, it doesn't look like any questions are coming in. Is there anything that you would like me to review in a little bit more detail, or?
No,
I know I went through that super fast.
No, thank you as always. Rachel, I'll notify the staff of the dates and open enrollment, and if we have any questions even after this meeting, or if anybody has any questions, just come to me, and if I don't have the answer, I'll go to Rachel.
Perfect, thank you.
Thank you, Rachel.
Bye.
Bye.